Hi everyone, and welcome to the 5th episode of Morris Animal Foundation's webinar series, Animal News 101, Chronic Kidney Disease in Cats, What Owners Need to Know. My name is Sean Anderson-Vai with the communications team here at the Foundation. As you know, our goal with the series is to cover topics that are of interest to pet owners and animal lovers in general. We get a lot of questions about pet care and animal health here at the Foundation, and we want to share some of our knowledge with you. For those of you who are new to the Foundation, we are a global leader in supporting studies that benefit the health of animals, including cats, dogs, horses, and wildlife. With the help of our generous donors, we fund scientists all around the world to do things like develop vaccines, diagnostics, and surgical techniques for serious health issues that animals face. We've been around since 1948 and were founded by Dr. Mark Morris Sr., a veterinarian and pioneer in animal medicine who recognized a need for research that would improve animal health. We'll get to the presentation in a moment, but first I'll review some of our housekeeping items. You should see buttons on the right side of your screen for questions, chat, and to raise your hand. If you have a question, please use the question button, but keep in mind we'll save them for the end of the webinar to keep things moving. If you have a technical question during the presentation, we'll do our best to help you behind the scenes. Also, we can't answer specific veterinary questions about your pet. If you have any health concerns, please speak with your family veterinarian directly. We'll have a handful of polls throughout this webinar, and in the interest of time, we'll give everyone about 15 seconds to answer them before I close them. We'll also send out a survey about the webinar later, and would appreciate it if you would fill it out. Tell us what you liked and didn't like about it, so we can better tailor future webinars to your needs. You can even help us choose future topics. Lastly, this webinar is being recorded, and we'll be sending out a link so you can watch it again if you'd like. Now, I'd like to introduce today's speaker, Dr. Kelly Diehl, our Senior Director of Science and Communications. Welcome, Dr. Diehl.
Thanks, Sean, for that great introduction, and thanks to everyone who is joining us today for this webinar. I think most of us know that chronic kidney disease is a pretty common problem, and I'd like to start with actually a poll. So Sean, if you can launch our first poll, I want to get a sense from all of you a little bit about how many of you own cats and have owned an elderly cat. So go ahead and key in. I have 3 categories, and I'm just, again, trying to get an idea for those of you out there and to find out how many of you have ever had to deal with an older cat. I certainly have, and could check off every one of these categories because I've had one cat that lived to 20 years and a little bit older. And excellent. So the results show that many of you have had a cat that lived to at least 15, and wow, good for you guys who had 18 or older and 20 or older. Next poll, go ahead, Sean, launch the second one. And this is specific. I'd like to get an idea how many of you have ever had a cat that was diagnosed with chronic kidney disease. And while we're doing the poll, I wanted to go through our webinar outline. I'm not trying to make you guys experts in chronic kidney disease, but really try to help you understand a little bit more about the disease and how it starts, a little bit about diagnosis and treatment, and we're going to end with an interview that I did and recorded with Dr. Jessica Quimby, who's an expert in chronic kidney disease. And in that interview, I asked Jessica a lot of questions about where we're heading with it. So wow, a lot of you. So I hope you guys can see that poll that 87% of you have had to deal with a cat with chronic kidney disease, showing, really emphasizing how common it is. And I wanted to talk first a little bit about terminology. For those of us that are not youngsters, and I would include myself in that, the terminology has changed over the years, but it means basically we're talking about the same disease. And many of you may have heard that your cat was diagnosed with renal failure or chronic renal disease or chronic renal failure. And those were all terms we used years ago to describe the very same disease. Most people have now settled on the term chronic kidney disease, which is a better descriptor of what's going on, because even though the kidneys may be damaged, they may not be failing. We know that in the general cat population, there's a prevalence of this disease of 1 to 3%, which might sound a little low for you guys who've had elderly cats, but I think the next statistic really tells us what we all know, any of us who've had an elderly cat, that there are estimates of 30 to 50% of cats over 15 years of age have some form of chronic kidney disease. And that percentage goes up as cats age. And I can tell you, almost all of my old kitties that lived greater than 18 years of age, really what precipitated their decline or death was kidney failure. One thing that's a little different, we're not going to talk about dogs. Dogs' kidney disease, chronic kidney disease, looks really different than cats. But one thing I will say that's different is cats can have very stable kidney disease, chronic problems for years and years and years. They can have little episodes of decompensation where maybe their kidney parameters get a little worse, they can get a little better. And this is actually different than what we see in dogs who have, if you graphed their kidney disease over time, it would look kind of in a very straight line, gradually going up. And that's not the same for cats. So again, a little bit different there. I want to review the anatomy of the urinary tract, and not again to make you experts, but because I think it's important to know the terminology. Obviously, there are paired kidneys, and that's good for us because we know that we can actually live on one kidney if that kidney is fully functional. And this diagram, you could superimpose this pretty much any mammal. So us, dogs, sheep, you name it. There are two ureters. Those are paired structures. There are tubes that connect from the kidneys to the bladder. And what's important to know about the ureters is they're really a passive conduit. Urine is formed and all the business end of the urinary tract happens in the kidney. Once urine gets to the ureter and then travels down the ureters to the urinary bladder and then out the urethra, there's no modification of urine occurring in those other areas. So that's important to know. Everything happens in the kidneys. These other structures are really important in just the excretion of urine, right? Urine goes down the ureters into the urinary bladder, which is a very muscular organ, lots of nerve endings also there. And of course, the bladder gets full, it senses that it is full, it contracts, and urine goes out the urethra. There's coordination between the bladder and the urethra. The urethra is also a very muscular organ with a lot of nerve fibers because there has to be coordination between the bladder and the urethra. We're not really going to talk about the incontinence today. That would be like a whole nother lecture. It's a very complicated process, but just for you guys to remember, there are two kidneys, two ureters. The ureters drain the urine into the bladder, and the bladder excretes urine through the urethra into the outside. I made a funny little comment here about bonus bits, and of course there's a big blood supply to all these areas. There are boy bits and girl bits that sort of interact with the urinary tract and are in proximity, but we're not going to address those today. So I made a funny slide here about what the kidneys do. And I think a lot of us know some of the functions that kidneys do, but may not realize that they're pretty complex organs and they're involved in processes we might not necessarily think that they're involved in. So obviously, kidneys are going to be important, right, in fluid balance. We know that because blood goes into the kidneys, is filtered, and the kidneys actively regulate fluid. If you're dehydrated, they're going to want to retain fluid. If you're overhydrated, if you have an excess of fluid, for example, if you drank a lot or pets drink a lot, we don't see that as often with them, but they can, then they're also going to actively, and that's important, actively get rid of that excess fluid. So again, kidneys that are working normally regulate fluid balance. They're also very, very important in the regulation of our body's acid-base status. Many of you may know that our body functions in a very, very tight pH range. And even small deviations to acidosis or increased acid in the blood, or alkalosis, which is increased base in the blood, can really disrupt all of our other organ functions. And the kidneys are very, very important in that regulation via the mechanisms of getting rid of hydrogen and potassium and chloride and some of the electrolytes that we think of. And those are, again, important in regulating pH. They obviously eliminate metabolic waste. And it is normal in our body as part of metabolism. And I'm going to talk about protein a little bit, and that's going to become important later when we talk about treatment and diagnosis. Proteins, just their normal metabolism, makes toxins that need to be excreted. And you've probably heard the term uremic toxin when people talk about kidney disease. And those uremic toxins typically are just the normal, they're not abnormal, normal byproducts, particularly of protein metabolism. When our kidneys are functioning fine, those toxins are excreted. When they're not functioning, they can build up and cause problems and typically make us feel kind of lousy and make our pets feel lousy when those start to build up. It is, again, very normal process, but the kidneys are very important in getting rid of these wastes. Likewise, they eliminate a lot of the drugs and other toxins that might come into our body. And even drugs that we take orally, we kind of think, well, if you take them orally, wouldn't after metabolism, they just kind of go out the GI tract? And that's not necessarily true, right? Many are absorbed through the kidneys. And where that becomes important in cats with chronic kidney disease is we often have to adjust or be very careful of the types of medications that we give to our cats if their kidneys are impaired. Another is, I already mentioned, balance of electrolytes, and I'm going to show a diagram that is going to be very busy, but it'll give you an idea of all the electrolytes that the kidneys handle and actually manage those levels in our body. Another thing that kidneys do is they're important in blood pressure control. And again, I don't think we think all the time of kidneys as being involved in blood pressure, but they are, and are animals. And one thing I'll mention here a little bit about blood pressure, and we're going to talk about this in more depth later, is that unlike in people, cats and dogs, and in particular, they don't get essential hypertension like people do. Like, we can be diagnosed with hypertension, right, and have no other problems, but we are hypertensive. And I think we all know that high blood pressure is a problem for lots of our organs. It is definitely a problem in kidneys, for the kidneys, but in animals, when we see high blood pressure, we immediately turn and look at their kidney function, because in animals, almost all of their elevated blood pressure is related to kidney dysfunction. So remember that, and we're going to talk more about that later, that link between blood pressure and kidney function. The kidneys are also important in red blood cell production. And again, that seems kind of weird. Like, you think of red blood cells being produced like in your bone marrow, in the vascular, the vascular system having something to do with it. But the kidneys actually produce a hormone called erythropoietin, which is important in stimulating red blood cell production. And if you're putting 2 and 2 together, and you've ever had an animal with kidney disease, you know they're often anemic. And that is because it's not because the mechanism for making red blood cells is problematic. They can make plenty of red blood cells, but they're missing that key hormone to stimulate red blood cell production. And that's one of the treatments we sometimes give cats that have chronic kidney disease, and many of you may have experienced that. We give exogenous source, or we give them injections to stimulate red blood cell production. And finally, the kidneys are also important in producing the active form of vitamin D. Again, something you may not think about, right? You think of vitamin D and skin and sunshine and GI tract because we take in fortified foods, but the kidneys are also really important in the balance of vitamin D. So moving on, I know this is just like a crazy, crazy diagram, but the idea here is to talk about the nephron. And the nephron is the actual functional unit of the kidney. So your kidney is just a collection of thousands and thousands of nephrons. And the nephrons are actually a little bit different size, but the only 2 things that you need to know for nephron function is that there's this thing called a renal corpuscle, also known as the glomerulus, And that's where blood comes in. So blood that's going to be filtered comes into this very beginning of the nephron, and that area is very, very important for, again, filtration. That's where some of the blood pressure stuff is happening. And then after being that initial point of filtration, what is going to be eventually urine goes into this really, there's a good reason they're called the proximal convoluted tubule and the distal convoluted tubule, this really complex tube system where a lot of modification happens. Water moves in and out, different electrolytes, glucose, a whole bunch of things. And by the time that product reaches the collecting duct, it's going to look a lot like urine that's going to come out the other end. The collecting duct, those empty into what becomes the ureter. So again, nephron is the basic unit of the kidney. It performs all these different functions. And again, this is where the modification of urine actually happens. Now I have, sorry, more nephron stuff, but this is actually a bird's eye view of the glomerulus, or that renal corpuscle, which is the very first area. And this glomerulus is really cool because blood comes in here and then it goes into this big giant tangle like this of really tiny blood vessels, and there's cells there, and this is where the modification of urine actually starts. So it's a really, really, really important structure. And one thing I want to talk about before we move away from nephrons is for you guys to know that one of the problems with a nephron is if one area is damaged, the whole thing is damaged. So you can't have a glomerulus that may not be functioning very well or is damaged, but the tubules are still working, and vice versa. And that's a problem when we start talking about kidney disease and loss of function. So we're going to now have, because I know you guys are just now real experts in anatomy and physiology, is we're going to launch 3 polls. So let's launch our 3rd poll. And I want to make sure before we move on, you guys have some idea on the anatomy and physiology, because it's going to be really important to understand some of this before we move on to the rest of the lecture. So the first question is about the structure that carries urine from the kidneys to the bladder. And is it the ureter or the urethra? And we're just finishing up our last few questions. Keep keying those in. This is kind of an easier one. We'll start off with a little bit easier question. Very good. 92% of you answered correctly. It is the ureter that goes from the kidney to the bladder, and the urethra goes from the bladder out. So next poll. We're going to get a little harder here as we go on. So what is the basic functional unit of the kidney that I just talked about a whole bunch? So think about that. Again, what is the basic unit? There's thousands of them in the kidney, and they work together for kidney function. But our last poll is going to be the hardest. So let's see how people did on this. Very good. Most of you answered correctly. It is the nephron is the basic unit, with the glomerulus and the tubules being part of, together form a nephron. So last poll, and then I will absolutely give you guys a little bit of a break on having to answer questions. So which of the following is not a kidney function? Sorry, that's hard because I gave you that big giant list, but if you guys can remember what is, and this is a bit of a trick question. Even I had to think about this for a minute. And yeah, so this was a trick question. It's actually drug metabolism. The drugs typically aren't metabolized in the kidney, they're metabolized elsewhere, but the kidney is important in excreting. So again, really complicated, right? The kidney does lots of things. So let's move on here. You guys, again, get a break from quizzing. You didn't realize you were going to be in school today. So diagnosis of chronic kidney disease, and this has changed a lot, I think, in the last 30 or 40 years. I hate to say, when I graduated from vet school probably 30 years ago, we were not doing as many routine blood panels, right? We would see a pet that was sick, do blood work and find that they had kidney disease. And they often had clinical signs, right, associated with that, which can be they don't eat well, vomiting, drinking lots of water, and excreting a lot of urine. And that goes back to that fluid balance problem where kidneys have to be functioning well for them to either concentrate urine or excrete excess. So they're drinking lots of water because they just can't retain and absorb fluid. They may be again losing weight, and that can go along obviously with poor appetite. Sometimes they have breath. You can smell uremic toxins actually on the breath sometimes. That's not where we really want to diagnose a cat with chronic kidney disease. And things have changed a lot because I think we catch a lot of cats earlier because routine blood work, right? And I do this not only when I was a vet would I recommend it to my clients, but as a cat owner, I do this now when my cats start to get above 7 or 8 years of age. I'm going to do some routine blood work because I want to catch disease early. So I think we find chronic kidney disease and we're doing a much better job of catching it early, which is always good. Other things we're going to look at are obviously a urinalysis. If kidneys are making urine, the urine can actually tell us a lot. Not always the easiest, right, to get in our cats, but so very, very important because it's important to look at a urinalysis when you're looking to interpret blood work. Then there's a whole bunch of other stuff we're going to do. We might check blood pressure routinely in animals let's face it, we all go to the doctor, we get our blood pressure taken all the time. And that's becoming more common in veterinary practice. We might do imaging. I will tell you, as an ultrasonographer, I loved imaging kidneys because they are one of the easiest organs to image. And a lot of diseases look very peculiar. They're very, you can ultrasound and go, wow, this looks like a chronic kidney problem. This looks like a kidney cancer problem. This looks like, oh, wow, there's some stones in here. There's some obstruction. Sometimes infection causes changes. So if there's been a blood clot or an infarction to the kidney, we can often see that. So again, imaging can be very, very helpful. X-rays are okay, but they're not great for the kidney. There are other things that are much better. We sometimes measure protein in the urine. We talked about protein metabolism and kidneys earlier, and we're going to get back to that, especially when we talk a little bit about diet. We might do things like a urine culture if we suspect an infection in the kidney. Maybe not often. Cats don't get as many urinary infections as dogs. There's some people who think we may miss them more often. But anyway, there's other things that we might do to diagnose it. Just very, very quickly, what is the composition of urine anyway? What would we expect normally? Well, water, mostly, kind of obvious. We have inorganic salts. Again, the kidneys are going to regulate sodium and chloride and potassium, for example, and so those are going to be present in the urine. And other organic compounds, sometimes which are easier or harder for us to detect, or we don't as much. I think, we all hear about athletes who have to pass urine tests, right, for steroids, but it's normal for some hormones to be excreted in the urine. This is just a real quick picture of a urinalysis, and we're going to obviously look at the color, the appearance. Maybe some of you have seen this if you get a copy of your cat's blood work. And we're going to do this dipstick, and we're going to do a quick and dirty test for like protein, glucose, ketones, and other things. We're going to spin urine down, and we're going to look for how many white cells are there, how many red cells, casts, which are actually a reflection of the tubules. You remember that big complicated tubule system. We're going to look for crystals, bacteria. Sometimes we see other stuff in there. But anyway, this is what a urinalysis would look like. And I want you to look at that highlighted blue bar that says specific gravity 1.038. What the heck does that mean? There's a scale there where we're going to talk about it because this is, I think, something that's complicated and that you may hear about from your vet, but I want to try to spend a minute or two talking about it. This is a little commercial about specific gravity. And what specific gravity is, you get a drop of urine, you put it on this cool thing called a refractometer, you close the lid, and on the right panel there, you see that circle with, numbers on it, and that's exactly very close to what it looks like. And what you're trying to do is comparing the density of urine to the density of water. And there's a range. So if you are out in the desert, or your cat's out in the desert, or has no access to water, you're going to want to retain water as much as possible. And your kidneys should do that. And what it does is it pulls as much water as it can. It has to work to do that, okay? That's important. Your kidney has to be functioning normally to reabsorb water and concentrate urine. That's a very important function of the kidney. There's also a flip side. If you are overhydrated for some reason, and some of us, it's not so common in our animals, though they can compulsively water drink and take in excess fluid to what they need, and that your kidneys also have to work to dilute your urine. So again, we just went through Oktoberfest. Probably your cat's not participating in Oktoberfest, but maybe you are. And if you're, drinking a lot of beer, you're going to make a really dilute urine. You don't need all that. If you're well hydrated, you don't need all that excess fluid. Probably not good for you anyway. Cats the same. They have to work to dilute their urine. And this is important because when kidneys aren't functioning properly, they basically act more like a passive sieve. That water just kind of passes through, and that is in a range called isocynuria. So the urine is the same as the plasma. No modification is happening. And where we particularly look at this is if I have a dehydrated patient, I am going to expect that they're going to have concentrated urine. So if I have a cat that comes in that I'm like, this cat seems dehydrated. Whoa, how come they're not concentrating their urine? They're isocynuria. Their urine is the same specific gravity as plasma. That is an enormous, enormous red flag. The other thing I will tell you is the ability to concentrate or dilute your urine is one of the first things that you lose when a cat develops chronic kidney disease. It's one of the first signs. Their blood work might be okay because they need more, what's that functional unit? Nephron loss before their blood work changes. But they'll, as they start to lose nephrons, isocynuria is one of the first things we'll see. However, it means that anywhere from 50 to 67% I've seen of the nephrons are lost. That means both kidneys together by the time you see isocynuria. So this is just a quick blood panel. This is my own cat. At the time, Ahab was 15. As you can see, his BUN is a little high, and that is something that we do look at periodically for kidney disease. You may have heard of it. People used to use it a lot more. Most of us now look more at the second value, the value right underneath the BUN, which is creatinine. That is a more sensitive function of, or sensitive measure of kidney function. The BUN can be influenced by a lot. It can be influenced by muscle mass more than creatinine, diet, intestinal bleeding. It's more sensitive to dehydration. So again, we will look at the BUN, but maybe not as much. My cat had GI disease, so I suspected that he had a little bit of GI bleeding, which is maybe why his BUN was up a bit. Other things we're going to look at this panel, which is measuring lots of different things, right, are things like calcium, magnesium, but particularly sodium, potassium, chloride, a whole bunch, because again, we know that those are the kidneys involved in regulation of those particular items. So what happens when good kidneys go bad? And we're going to talk a little bit with Dr. Jessica Quimby about this, because Jessica's research focuses a lot on why kidneys go bad, particularly in cats. And we know that even in big cats, so I'm talking about tigers and lions and cheetahs and other large wild cats, they also have kidney problems. It's harder to get a grip on wild cats because they probably die of their kidney disease, right? Because they're never treated. But we do occasionally, talking with people who do a lot of zoo work, they see it obviously in captive collections where cats live, big cats live longer many times than they do in the wild, but they also sometimes see it when they have wild animals that they may do a post-mortem on. If they're older, they often have some kidney problems. So it seems to be something about being a cat. We know that previous insults, including obstructions, I think those of us who've had boy cats We've had to worry about that or have experienced that where they become blocked. And even though their kidney values can go back to normal after unblocking and they can seem okay, we now know that they may have an insult that can then slowly progress over time. We know that inflammation, so recurrent urinary tract infections, recurrent inflammation, and there's evidence that inflammation plays a role in kidneys going bad. And then what happens is they start getting scarred and they get fibrotic. So there's fibrous tissue that comes in that replaces the normal nephrons. And if, for those of you who've ever had your kidneys, older cat kidneys palpated by a vet and they say, wow, and I can tell you from my experience, they feel firm, they're small, they're lumpy. We know that some scarring has happened. We talked about nephron loss, right? For a while, the remaining nephrons will hypertrophy or get bigger. They try to compensate, but then they're eventually overwhelmed. Tubulointerstitial nephritis, giant word, is the most common cause of kidney. If we look at chronic kidney disease under the microscope, we see this kind of inflammation. So it seems like the tubules go first. And remember, we said tubules go first and the glomerulus will go. This is one of the few times I'll talk about dogs. It's the opposite in dogs. They tend to get problems first in the glomerulus that then affects the tubules. So I'm going to talk about a classification scheme that's very, very important, and it's an attempt by a bunch of very smart veterinarians, much smarter than me, who were all experts in nephrology and urology, and about 22 years ago, they sat down together to try to standardize how we talked about chronic kidney disease. Part of it was because there was lots of literature, but people had different definitions for what they called chronic kidney disease, and it was leading to some confusion. So they led to standardization not only in terminology, but also to establish guidelines for treatment. And I'm going to say it here, and I'm going to say it again later. If you guys have never gone to the International Renal Interest Society, if you put IRIS in, you should get it on a Google search. You should go. They have great information about all kinds of, from acute kidney injury to chronic kidney injury. They talk about dogs, they talk about cats, they talk about what the literature is, they talk about what they're working on, and I would encourage people to go there. Anyway, what they did is they have classified kidney disease, chronic kidney disease, into 4 stages, and they use just 4 things, just 4 parameters to place a cat in a stage, which stage of chronic kidney disease they're in. Just 4 things. 1, blood creatinine. And we talked about blood creatinine is a byproduct actually of muscle metabolism, but it is filtered almost exclusively by the kidneys. So when kidney failure starts to happen, the creatinine starts to increase. Another one is the SDMA, which you may have seen. This is probably the last decade we've been using this more, and it's the serum symmetrical dimethylarginine. And SDMA and creatinine, SDMA is also a byproduct of metabolism, not muscle, but the 2 of them are a very sensitive measure of how the glomerulus is filtering. So that very first part of the nephron. To be clear, creatinine and SDMA are not produced by a failing kidney. So it's not that kind of measurement. It's not like, oh, the kidneys are having problems and they produce these substances that then go up in the blood. These are just not being filtered and therefore are on the increase. So they're very, very important measurements. The third thing that you're going to look at to put your cat in, figure out which stage they're in, is protein in the urine. Because again, protein is filtered and should be filtered out generally through the kidneys. So protein in the urine, we're going to be really interested in why that's happening when we see it. And blood pressure. We talked about blood pressure before. And the reason these 4 parameters were chosen is because of their sensitivity in picking up that the kidneys are not functioning well. And they also tie into long-term prognosis. So guess what? It's quiz time again. So we're going to launch our last quiz, and then I promise you can sit back and relax for a little bit. But I'm going to ask you what I just talked about. Which of the following is not part of the IRIS staging system? Remember, there's only 4 parameters. We just talked about it. And I want to see if you guys can remember, because it's really, really important to think about and know these parameters, particularly if your veterinarian tells you they need to run extra tests or whatever. So very, very good. You guys did great. That's right. BUN is not part of the IRIS staging system. So moving along a little bit to the treatment of chronic kidney disease, it's really individual, and it depends a lot on what stage of IRIS stage your cat is in. There are two arms to treatment. One is treatment aimed at slowing progression of disease. The other arm of treatment is making your cat feel better to improve their quality of life. So when we think about it, it's instead of thinking about all the different things we could do, we should think about slowing progression, which is really important maybe in the early stages, right? You want to slow progression, versus when a cat gets to stage 3 or stage 4, they're feeling lousy, and we're often doing things to make them feel better. Diet will slow progression, and that is controversial. We're going to talk a little bit more about it, because even though we've been altering animal with kidney disease with diet and improving it for probably 80 years now, that long we've been doing it, there's still a lot we don't completely understand about diet and progression. We're going to maintain hydration, and that could be giving, making sure that your cat has access to really clean water, really fresh water. Some cats really groove on those fountains. My cat did when he got older and got kidney disease. Some will drink out of the spigot, right? I've had cats do that as well. Really, really important to do that. Some of you probably know how to give subcutaneous fluids. We're going to want to maintain their appetite through a variety of things. Anti-nausea medications and appetite stimulants, and Dr. Quimby will be addressing that a bit. We're going to correct their anemia if we can through injectable forms of erythropoietin. But that's usually pretty advanced when we're getting to the point of correcting anemia. And hydration, appetite, anemia, and the next one, lowering phosphorus a little further, are usually things we do to make cats feel better, though lower phosphorus also falls into slowing progression. The major source of phosphorus is protein. So by lowering protein in a cat's diet, we're going to lower phosphorus as well, but sometimes we put in phosphorus binders. Those are falling a little bit more out of favor, but we occasionally use them. And we're going to treat high blood pressure, and that treat high blood pressure falls in the category of slowing progression. There are also certain antihypertensive medications. Many of you have probably heard of ACE inhibitors. ACE inhibitors also decrease protein loss in the kidneys. So dietary management, this is kind of a third rail, but I'm going to try to tackle it for you guys. There's no question that reducing the amount of protein in the diet of a cat will increase their longevity if they have kidney disease and make them feel better. Because what did we talk about? Uremic toxins are mostly byproducts of protein metabolism. Now, where the controversy is right now is, what is the sweet spot for a cat with kidney disease? Like, how much reduction in protein? Most of our commercial adult maintenance cat diets have 1.5 to 2 times the amount of protein needed to just maintain normal body function. So they tend to err on the side of excess protein. So a lot of our kidney diets are just backing that down a little bit to the maintenance requirements, okay? So they're cutting protein. They may go a little bit further, but you don't want to start losing muscle mass. And again, finding that sweet spot is an area of a lot of active research. We're going to reduce phosphorus and sodium, and most prescription kidney diets have reductions. Obviously, we talked about phosphorus being protein related, and sodium. Most diets now are increased in omega-3 fatty acids, and that's not a bad thing for cats with kidney disease. And this is something that when I was in vet school 30 years ago, we didn't talk about. We started talking about 20 years ago that maybe fatty acids are good things, and now they're pretty standard practice. We're going to increase antioxidants in these foods, and fiber, another thing. When I graduated from vet school, we didn't talk about fiber and kidney disease, but now we do. And we know that can help. We're also going to have sometimes increased vitamin D and potassium. I think a lot of you, and we've known for a long time, that cats with kidney disease, I'm going to use a bad term, but we're going to use it anyway, in quotes, waste potassium. They tend to lose potassium in excess of what they should. And so adding potassium back in the diet is really important. The controversy also is, when do we start? And some people are now advocating that we start cats on kidney diets when they're in IRIS stage 2 versus waiting till they're sick in 3 and 4. And you guys know that trying to feed a cat with pretty advanced kidney disease a kidney diet is often an exercise in frustration, and it's hard. They feel lousy. You're giving them a new diet. You're changing things. Some of those diets, I think, are less palatable, and it can be really, really, really challenging. And that was like one of the major complaints of my clients when I was in practice, and I get it. It's really hard with cats when they're advanced to get them to eat the renal diets. However, if you start them early, there's evidence they're more accepting of them. And again, we're trying to slow progression. So I'm going to play a video right now, which is my interview with Dr. Jessica Quimby, and we're going to talk about future directions.
I'd like to thank Dr. Jessica Quimby for joining us today in this virtual interview. And I know many of you have probably heard of Dr. Quimby, but to run through her qualifications, Dr. Quimby is board certified in small animal internal medicine, and that's the American College of Veterinary Internal Medicine, ACVIM, of which I am also a diplomate. And she completed a PhD in feline chronic kidney disease. She was faculty at Colorado State University until 2017 and is now an associate professor at The Ohio State University. Her current research areas include renal pathophysiology, novel treatment strategies, and feline clinical pharmacology, focusing on improving supportive care and the quality of life for cats with CKD. Dr. Quimby has received the International Renal Interest Society Award and the AVM Win Feline Foundation Research Award for her contributions to nephrology and feline medicine. So welcome, Jessica. We really appreciate you joining us for this little webinar. And
Thank you so much.
For everyone watching, the reason I asked Jessica to come on was to really focus on where we're going with chronic kidney disease in cats. I mean, obviously, it's been around a long time. We've recognized it. We know it's a large problem in our cat populations, but Jessica's been on the cutting edge of some different ways of approaching the disease. So, Jessica, I'd like you to start with talking a little bit about your work in trying to look at why this disease happens, the pathophysiology in cats.
Yeah, sure. I mean, that's the million-dollar question, right? Is why do they get chronic kidney disease, and why is it so common, especially in older cats? And honestly, even though it's a very common disease, there's actually a lot about the pathophysiology or the disease process that we don't really understand for cats. And we sometimes can use information that we know from human studies and then apply it to feline studies to discover, do cats have the same pathophysiology of the disease as other species? And sometimes the answer is yes, and sometimes the answer is no, because of course cats like to be unique. So we've definitely spent some time trying to do more studies, and we're not the only one. There are definitely several other researchers interested in this area, of understanding more about how the disease process progresses and what are the pathology, what goes wrong during the disease. And that's really important, because if we understand that better, then we will understand better how to treat it and looking for therapeutic options to intercede with the disease process. And not only that, but as I alluded to previously, we don't know why it started in the first place. And so part of the work that I've done is looking at actually the aging of the kidney and trying to understand how it is as the kidney ages, it starts to malfunction even before you get clinical evidence of kidney disease. So there may be changes that are happening in the kidney in your older kitty that are leading you towards chronic kidney disease even before you notice that there is something going wrong. And again, there, if we can understand that process, there hopefully would be therapeutic targets leading in early kidney disease that we would hope to be able to target.
Great. And that you just mentioned the treatment aspects. So I'll ask you, what new avenues of treatment or what refinements of treatments already in use are you seeing people looking at or you're looking at yourself?
Yeah, so I mean, I'm happy to say that myself and my colleagues in kidney disease there's a lot going on, actually. It's really exciting to see the amount of kidney disease research that's happening. And me personally, one of the things that I focus on really very basically is nutrition and making sure that we are picking the best nutrition that we can and that the cat is actually eating it. And so from that standpoint, we have a number of studies focused on nutrition, diet study or understanding the microbiome of the intestine and how that influences nutrition. But then also on the other side, the clinical side of getting the cat to feel better and want to eat. So that's where our work in appetite stimulants and anti-nausea medications has been very important, because if we can't fix the kidney disease, we want to be able to support them as much as possible and have them feel as well as they can and to eat well, to maintain their muscle mass and maintain their weight. Those cats that are meeting that goal are, in our opinion, going to do better than the cats that are really struggling with their nutrition and losing weight, and that's really hard to see. So that meeting that nutritional goal, although that seems very basic, is actually a big therapeutic target that we have. So we think about those things, and again, that's where the clinical pharmacology, or that just means, what do I know about the drugs and how they work in kidney disease? So that's a big focus for us as well.
What exciting, I guess, avenues of research or new questions are people looking at, and where are you looking to go with your research as you move forward?
Yeah, that's a great question. I mean, it's hard because there's so many things there's so many exciting things that we could be discovering and that we're working on. I think I'd pick a couple of topics surrounding that nutrition question. So we are trying to understand better the best diets to feed, and then also from the standpoint of the appetite stimulants, what, for instance, is the effect of that on weight and muscle mass and quality of life? Those types of things are quite important. And also the study of appetite dysregulation. So getting at why it is that the cat actually doesn't feel well enough to eat, and how could we intervene there? So that's been something that I've wanted to do for a while, and we're starting to take a look at that now. Where we're actually trying to study the pathophysiology and the hormones that are involved in making you hungry, making you not hungry. And on the human side, there's a lot of really great information about the dysregulation of appetite in kidney disease, and we'd like to really apply that to cats and see if we can describe how it is that their appetite goes wrong and what we could do to help them out with that.
Right. So I'll have you finish with one question. I think most of the folks here, and I would include myself, have owned cats over long years. And there have been some big changes, I think, some small changes and some big changes in how we treat chronic kidney disease in cats. And I've seen a sea change as an old, and I do mean older, a practitioner from what I learned seriously 30 years in vet school, 30 years ago, and trends, and I hate to say the word fads, but you've probably lived through the fact that we would try this or that. What for folks out there, what changes have you seen, and maybe focus on treatment? You mentioned appetite stimulation, I think has really become prominent, but what other areas, if people have had cats and maybe had a cat 20 years ago with chronic kidney disease and have one now, like what trends have you seen in treatments that maybe people are like, well, wait a minute, I think I did this with an older cat and we're not doing this anymore? I know that's a big topic, but.
Yeah, it is. So, I mean, I think two of the most influential feline things in general, of course applicable to kidney disease, would be the appetite stimulants. So like when I first came out, I was in feline practice, and we used a lot of cyproheptadine, the drug, and it just never, it was okay, like it helped some cats, but at that time, the couple years that I was in private practice and feline practice before coming back to the university to study more and to specialize was actually when we were transitioning from cyproheptadine to mirtazapine. And we were like, wow, this is very beneficial, but we need to know more. So we did a series of studies to figure out how to use that medication better. And now that ultimately led, not necessarily just from me, but that ultimately led to having a transdermal form available, which is like the penultimate kitty thing, like, hey, we don't even have to pill the cat, and proving that that is effective. So that to me is a huge sea change from the standpoint of now really encouraging people to be more aware of nutrition and think about counting calories, not the way we normally count calories, but the standpoint of making sure we're getting enough calories for the cat, and then really making sure that we're meeting those goals. So we use mirtazapine, and especially the transdermal form, like long-term in the management of disease. We think much more about that nutrition aspect, that hydration aspect. We're definitely more free, I think, or more encouraged to give the anti-nausea medications. I do still encounter practitioners who don't think that nausea medications are necessary for kidney disease. And that's hard for me to understand, because there's all these toxins that are building up in the blood, and that's another thing that we've been studying is all these uremic toxins, and how do we stop them? How could we stop them from being formed? Those things must make you feel very ill, and what can we do to palliate that? And then I think the last really big thing is just getting your cat to the vet, honestly, is so important. And we've had a lot of people concentrating on feline-friendly practices and cat, stress-free cat handling, and really thinking about things from the cat's perspective. Because of course, once you have chronic kidney disease, we do need to see that kitty more frequently to make sure that we're doing what we need to do, and drawing the labs for monitoring, or making sure that we see them frequently enough that we catch any complications of disease. And so one of the other things that we've studied is what's become very popular is giving gabapentin in order to relieve stress, to get them into the vet. And this is something that definitely, as you said, is a big trend, right? But what's important to know is we actually need to do that a little differently for cats with chronic kidney disease, because they process the drug differently because of their disease, and they may need a lower dose or a less frequent dose. And so that's some work that we've done recently. We just presented this past year, and we'll be putting in for publication soon, just to make sure that everybody understands that it can be a really beneficial thing, but we don't want to overdo it in those chronic kidney disease patients. But it makes such a huge difference. And for me, doing clinical trials, it's very important to me that the cat is not stressed as much as possible. Of course, when they come in for an appointment, we pay very close attention to that. We don't want to enroll kitties that would be too stressed to participate. And gosh, I wish I had this medication, 10 years ago when I was doing some of these things. It would have made a huge difference for our studies and made me feel better, the cat feel better, and probably the owner feel better as well. And we encounter that every day in our practice, and feeling better about getting that cat into the vet and having them be not so stressed, making sure we know what their safe or the dose where they're not going to get too sedate is. So that's been a huge change, I think, in feline medicine, and also for kidney disease. My own cat that suffered from kidney disease, she was just so stressed her whole life. And I thought, how am I going to do this? And she was one of the patients that we discovered that would be really good for the gabapentin. And it hugely changed my willingness to bring her in and monitor her and do what needed to be done in the last years of her life. It was a huge benefit for her. So to me, those are like a couple of really large things that have changed in terms of our outlook and how we can do more for our feline patients in general.
Well, that's great. Well, that is all of our time. So that went so fast, Jessica. I appreciate Dr. Quimby making like a celebrity cameo on our webinar. And thanks again so much, Jessica. I know you're super busy, and I really appreciate you carving out the time to.
You're welcome. Absolutely. Thank you so much for having me. I really appreciate it.
All right. Take care.
Yeah. Bye.
I'd like.
So that brings us to the end and questions. I'm going to do as many as I can. We actually have time carved out till 12:15, and that gives us a good 15 minutes to answer whatever I can for you folks. I will try to be more general. It's hard for me to answer specific questions about a specific cat. So we'll see if I can at least get some of your big questions answered. So Sean, whenever you want to fire away, go ahead.
Yeah, sure. Let's go with this one. So what about the use of acid blockers for cats with kidney disease?
Right. You guys may have noticed that we didn't talk about that. And I would say a good 10 to 20 years ago, we used a lot of acid blockers, right? And many of you with cats, you may have used omeprazole, which is also Prilosec, or cimetidine, or ranitidine, or Pepcid. And that's changed a lot in the last couple of years, the thinking on that, because there is not great evidence that, first of all, that the acid blockade really makes any difference in cats with chronic kidney disease. And the reasoning behind all of that is people with kidney disease tend to get ulcers in their stomach, and it contributes to nausea and not wanting to eat, etc. And people started to give these acid blockers thinking, with the thinking that maybe cats are getting ulcerative lesions. We do know that sometimes those acid blockers help with nausea, and I definitely saw people and had clients and had my own cats that seemed to feel better sometimes when they were getting acid blockers. That being said, we all know that pilling cats is a giant pain. These medications don't really come in an injectable form that we can use easily. They're intravenous forms, but not oral or subcutaneous that people can give. And what some very, very recent work in the last couple of years, one which is, I'm happy to say, was a study that the foundation here funded, was looking at ulcerations in cats and metabolism of acid blockers. And it turns out that cats don't typically have ulcers in their stomach related to kidney disease. That being said, certainly, as Dr. Quimby mentioned, we may still want to give anti-nausea drugs, but giving acid blockers probably isn't that helpful. And I know, as a cat owner, if I can have one less oral drug, I'd be really happy to not have to give it. The other thing that Jessica mentioned is this idea of the microbiome, which is the kind of community of bacteria and viruses and everything that live in our bodies and on our bodies. And there is growing evidence that skewing by acid blocking in the stomach, you're altering the microbiome, for lack of that's a really simplistic view. And then what are you doing when you chronically do that? We know that in people, by giving chronic acid blockers, you actually open people up to C. diff infections. We don't see C. diff a lot in cats, but the question is there, right? If we're constantly blocking acid, maybe we're doing other things we don't know about that would be detrimental. But bottom line is you probably don't need to give an acid blocker to your cat with kidney disease.
Okay. Second question. I thought cats had high protein requirements. Isn't it bad to limit their protein even though they have CKD?
Right. So that is a good question, because we do know that cats have a higher protein requirement for maintenance than dogs, and they have very specific protein requirements as well. And right, so you're limiting protein in an animal that needs a lot of protein, and it comes down to trying to find a new sweet spot for what are the protein requirements of a cat with chronic kidney disease that maintains lean body mass but decreases the amount of protein being presented to their kidneys. And again, it's quite clear through several really good studies done in the last probably 15 years that cats being fed maintenance diets are quicker to have uremic crisis or have much more significant worsening of their kidney disease than cats being fed a renal diet. We've known for a long time that renal diets are important in slowing progression, but these more recent studies really did head-to-head comparisons. All right, next one.
Yeah. How to handle bad constipation with chronic kidney disease?
Ooh, yeah, probably due to hydration, right? So I think maintaining adequate hydration, which could be through the administration of subcutaneous fluids. There are new hydration products out there. I obviously have never used them. They're just out in practice in the last year or two that are supposed to be helpful in maintaining good hydration, because typically these guys get, right, they just get kind of dehydrated. There are stool softeners that you can give, being careful, right? Because these guys tend to be a little dehydrated, so you can lose fluid right through your colon. The colon is also a place where fluid is reabsorbed, and so obviously you're going to be reabsorbing fluid there if you're in a dehydrated state. So really maintaining hydration, sometimes the very careful use of a stool softener is helpful for these cats that get constipated.
Okay. I am currently feeding my 18-year-old Hills KD, plus he gets Miralax, Cisapride twice daily, steroid for arthritis every 3 days, heavy cream twice a day, and laxative daily, and Royal Canin fiber dried food daily, and he still has constipation. No blockages have been found. How does one combat that with kidney disease?
That would be pretty tough. I think that might be a cat where routine enemas might help, because you're doing pretty much everything you can short of surgery, where the colon, you can do a subtotal colectomy where the colon is removed, but nobody's going to want to do that, right? You don't want to put a cat with kidney disease under anesthesia. So it's possible that at this point, trying a different diet might help. Whether fiber might help or not, if they're on a kidney diet that might be already there, or this may be a cat that requires some enemas. If the colon gets dilated for long periods of time, some of the nerve connections become stretched and they lose tone. And so what I would do with a cat with constipation anyway is deconstipate them and keep them from getting reconstipated and obstipated, which can help sometimes reestablish the contractility of the large intestine.
Okay. This woman is asking, she'd appreciate any advice or feedback regarding appetite stimulants, as well as strategies to improve appetite for cats with chronic kidney disease.
Definitely the mirtazapine that Dr. Quimby mentioned. I think many of us used to use cyproheptadine, and with variable success. Mirtazapine has been a real game changer for a lot of cats. And as she said, the transdermal use is great because it's one less pill you have to do. Other things that I would tell people to do is, if you have canned kidney food, fry it. Sometimes that was help. Warm it up is often one way to both aromatize the smell, and some cats just find it more appealing to eat something that's warm versus cold. And that's obviously for canned food. I sometimes, for my cat, I don't know if this is an old wives' tale, but it worked, is add a little garlic. Again, I think the idea, because cats, they like the pungent smell, that might help with appetite as well.
Okay. Next question. What is the value of the additional diagnostics, i.e., do these help inform staging of disease and treatment of options, or do they merely confirm presence of CKD?
That's a good question. If we're thinking to the staging, so you're going to have to do blood pressure, urine protein measurement, and let's talk about urine protein measurement. I didn't dive into this. You remember the little dipstick, and we all do the dipstick urine test, right? So we dip the stick in, and you'll get an idea of how much protein is in the urine. That is not very accurate, but it is something. And if the protein was a little bit higher than I would expect, we would then collect urine very carefully, right? Usually through cystocentesis, which is putting a needle directly into the bladder. Sounds horrifying, but it works great. in cats, and looking at a more sophisticated measurement of protein. And you'll often hear urine protein creatinine ratio. And for staging, you actually need that more advanced testing. It is not necessarily very expensive. And usually what's recommended by the Irish Society is that you do dipstick protein measurements. I mean, you could do UPC, but they're expensive. You have to demonstrate that the protein's there for a couple different times. So they talk about one test, two tests 2 weeks apart to see, because there can be some variability normally in your protein excretion. So I would never necessarily jump to a UPC expensive test without being able to demonstrate on a couple different dipsticks, which are cheap, that there was protein in the urine. Imaging. What does imaging help you with? It helps you sometimes sort out, like if I have a cat with really tiny little nibbin kidneys and they're 18 years old, I might not image them because I can probably tell you that cat has chronic kidney disease. In cases where I've got kidney disease and maybe the cat's plump or the kidneys don't feel quite right, but they're not tiny, I might image them to see, could this cat be a renal cancer, renal lymphoma? Typically those kidneys get really big and they're uncomfortable, but maybe I'm having trouble palpating them. I might want to know, is there a stone or something obstructing? Yes, x-rays are pretty good for stones, but they're not perfect. Infection will cause changes in the kidneys. So sometimes those are useful in finding out what is going on in the kidney that's causing renal function to not be great, because you're obviously going to treat renal lymphoma very differently than chronic kidney disease. And sometimes cats can have normal feeling kidneys and have some of these other problems.
Okay. How is SDMA measured?
It is measured in the blood. So it is on a blood test, and a lot of panels are now, you can get it on standard renal panels. That particular panel with my cat from a few years ago, it was not included on that. In my old practice, we used to have a renal panel that just kind of selected certain items we were particularly interested in, and we often used a renal panel. It costs less for people, and if we had cats with kidney disease. But SDMA is available commercially from a lot of different places, and a lot of people are adding it to their elderly cat screening. So what you couldn't see on that panel was that my cat was also screened. He was mildly hyperthyroid, which is probably part of the reason, I think, for the BUN. But anyway, some of those are now included on those.
Okay. What about a species-appropriate raw carnivore diet?
I don't know. I think that may be fine, but it depends on the protein level. And one thing I can tell you is I actually don't have a big preference over any of the prescription diets. It used to be whatever the cat would eat, that they liked. I often send people there are a lot of nutrition services now. I could use them as a vet, especially if the cat had comorbidities like has kidney disease and diabetes, or kidney disease and hyperthyroidism, something else, that I want a specific diet. Kidney disease, inflammatory bowel disease, I was a gastroenterologist, so I saw a lot of those. And you can go to a nutritionist and they will work with you on whatever you want to feed. Like if you say, I want to feed this, help me balance a diet for it, they will help you balance, because again, a lot of raw diets don't have fiber in them. Typically, but you can add that, right? There's ways of doing that. And so I would encourage people, it's probably money well spent sometimes to get a nutrition consult. Your vet can get them. Lots and lots of places do them. There are a lot of people out there and they do a great job. And for sure, they can help you really balance, so you make sure that you're not with your diet missing some essential nutrient.
Okay. Cats are often diagnosed only when their owners have noticed considerable weight and muscle mass loss. Why is it so difficult for those cats to gain weight once it's lost, even though they're eating good food and more than enough of it?
Yeah, that's pretty tough. I think we're still trying to learn about maintenance of lean muscle mass. And this is a lousy analogy, but I think all of us recognize if we had a disease that we let go for a long time and didn't go to the doctor, it is hard to regain what is lost. Plus, these are elderly cats, and there's a phenomena, even if you didn't have kidney disease, all of us experience it as humans, of sarcopenia, which is loss of muscle mass, right? It's why you don't see bodybuilders. You see 90-year-old bodybuilders, but they're not going to be able to lift with a 25-year-old, right? We lose muscle mass as we get older, and that is a really, really, really active area of research. And I know people who are using mostly dogs as a model for human disease to learn more about how do we maintain muscle mass as we age, because if we get really behind the 8 ball and we have a cat that's lost muscle mass and they have kidney disease and they're 18 years old, it's really, really, really hard for us to get that muscle mass back.
Okay. Can you talk about why binders are going out of favor?
Oh, phosphorus binders. Couple different reasons. One, they're a pain, right? They're a pain to administer. Cats hate them. I know there are people who are working on trying to make a more palatable type of phosphorus binder for cats that have more advanced kidney disease, because we know that even in spite of protein restriction, the phosphorus can go up and it's linked to prognosis, right? And but I think people are trying to shift to seeing if we can get a diet concoction that works better to keep the phosphorus lower than giving phosphorus binders. Some of our old binders also had the problem of binding medication at the same time. So there was always this timing, and there's timing issues when you give a phosphorus binder. So it's a good question. People, they are falling a little out of favor, except for more advanced cases. But I can also tell you that I have seen and heard of a couple different companies who are trying to work on more palatable phosphorus binders.
Okay, and we're at 12:13 now, Mountain, so let's do one more question, maybe two, but probably just one. Are GI issues a common link to CKD?
Ooh, good question. We don't know. I wonder if malnutrition in general, like if you had an absorption problem, you had chronic enteropathy if you're a cat, which is the new term for inflammatory bowel disease, whether just that eventually the kidney becomes affected because you're chronically, in many ways, malnourished. The other thing that's really intriguing that I've heard from a nutritionist very recently discussing the microbiome, he's also a nephrologist, and he talked about a link between the gut microbiome and the kidney, and the link is that if the gut changes, the bugs that are there change, they produce different substances that enter the bloodstream and obviously make it to the kidney. And he thinks, and Dr. Quimby may mention this as well, that there might be a link to changes in the gut microbiome over time that influence the kidney and could be one of the initiating factors of chronic kidney problems.
Okay. I think that's all the time we have for today. So I want to thank first Dr. Kelly Diehl, our Senior Director of Science and Communications, for joining us today with that very informative webinar, and our special guest today, Dr. Jessica Quimby of the Ohio State University Veterinary Medical Center. Thanks for being with us and sharing how we can understand CKD and help our cats live longer, healthier lives. And we want to thank all our viewers today. Looks like a lot of you were pretty engaged, and I hope you enjoyed it and found this helpful for your cats. We'll send a link to this recorded webinar soon if you'd like to watch it again or share it. We also hope you'll join us next month when we talk about the Pioneer 100 Horses Project. Until then, we'll see you next time. Have a good rest of your week.